Dr. Battaglia, call extension 198. Dr. Battaglia, extension 198. Paging Dr. Battaglia, call extension 198. Dr. Battaglia, extension 198.
Hi, this is Janet from Dr. Ayer's office calling to get a prior approval for an exam on a patient.
Please hold. I'll transfer you.
Has the patient ever tried omeprazole?
Hi, this is Janet from Dr. Ayer's office calling to get a prior approval for a cardiac stress test for a patient. Yes, they're having chest pain, dizziness, shortness of breath, and a family history of heart disease.
Please hold. I'll transfer you.
Approval has been denied. We need to do a EKG first, then a 24-hour whole life monitor. Pending the results from both tests, we can resubmit for approval.
Hi, this is Janet from Dr. Ayer's office calling to get prior approval for a CT scan of the brain. Patient has sudden onset of massive headaches, vision loss, and confusion.
Please hold. I'll transfer you.
Claim is denied until our investigation is completed.
Hi, this is Janet from Dr. Ayer's office, and I was calling to get a prior approval for Lamictal on a patient. They have a long-standing history of seizures from epilepsy caused by head trauma.
Please hold. I'll transfer you.
We are going to need a list of every seizure medication tried, what the results were, and the dates of each. Lamictal is not on the preferred medication list.
Room 3, well baby visit, with 5 vaccines.
Mrs. Smith, are you aware of what vaccinations we're going to be giving today?
Yes, I'm aware.
Here are the vaccine information sheets. Now, do you understand the potential side effects and what may occur?
I do.
And do you give your consent?
I give consent, yes.
I'm gonna need you to hold her legs down just above the knees for me, okay?
Room 5, female patient, in for a cold.
I mostly have a runny nose, sore throat, and sneezing.
I see. I need you to take off your underwear and sit on the table for me. I'm gonna need to examine your vagina. Nurse Janet, when I'm done here, I need you to run these samples to the lab stat.
Room 2, baseball-sized cyst on patient's back.
I wouldn't stand right there, doctor. Those things are pressurized.
I think I know what I'm doing, nurse.
Okay, doctor, whatever you feel is best.
Just going to make a small incision and... Oh! It went in my mouth!
And it's sizzling on the light.
Oh, God!
Room 5, adult well visit, medications review.
Mr. Taylor, we need to review your list of medications, okay?
I don't know what they are. One's yellow and about yay big. One's kind of pinkish and kind of oval. And one is blue and looks kind of like a cat treat.
Do you know what these are for?
I don't know. The doctors just give them to me and I just take them.
Room 7, depression treatment, side effects.
Can you tell me what's going on today?
I was standing over my husband with a butcher knife. I don't know. I just woke up standing there. I was going to stab him.
Have you had these thoughts before? Has anything changed situationally? Can you tell me when it started?
Right after I started this medication.
You're currently taking 30 milligrams of marcoxiflopin daily. I'm going to up that to 60 milligrams.
Room 9. Blood sugar levels.
Can you tell me what you eat for meals?
Why does that matter? I'm on medication to control it, and it's not working.
Diet is very important. What do you eat for breakfast, lunch, and dinner?
Let's see. Toaster waffles with butter and syrup, orange juice, sometimes a donut or two, chocolate with icing. Lunch is usually a sandwich on white bread with lunch meat and those Velveeta slices. I love those things. And some mayonnaise, a big bag of chips, 2 Diet Cokes, and some Little Debbies. Dinner, I eat TV dinners or frozen pizza, and some beers. I'm too tired to do much else.
Have any of your doctors ever talked to you about changing your eating habits?
No, ma'am, other than eating smaller portions.
Surgery suite. Circumcision of 1 week old.
Oh my god! My baby! What are you doing to my baby?
Nurse, have the mother calm down or I'm going to have her escorted out.
Surgical ward. Patient consent.
I know the surgery isn't scheduled.
There isn't even a slotted time on the schedule for this procedure.
Nurse, I'm in a hurry and I don't give a damn about the schedule right
We
now.
still need to get the patient to sign the consent forms.
Just get him afterward.
Room 12. Patient IV.
I don't understand why this IV isn't working.
Oh my god, the tubing is still clamped. Who set this up?
I don't know, there were 2 nurses in here before me.
Doctor's office. Migraine treatment.
According to the patient's chart, they have a history of high blood pressure and heart disease. This medication cannot be used on the patient due to the contraindications.
Give it to them anyway.
I most certainly will not. The manufacturer's warnings clearly
If
state.
you'd like to keep your job, I suggest you follow my orders.
Nurse's office.
Nurse Janet, this is an official write-up for refusing doctor's orders on March 21st regarding a migraine treatment. Fuck's sake.
Oh, fuck's sakes.
Of course, it makes perfect sense. For a sneeze and a cold, you get your vagina checked. Surprise, surprise. Creepy fucker.
Swelling of the legs from fluid overload.
Janet, you need to go back to school to learn how to grade edema.
Oh, really? Read!
Well, I went to school in the Philippines, and this is not how we learned it.
Staff lunchroom. Pfizer representatives.
Don't be shy. Help yourself to seconds. We made sure Olive Garden knew they were feeding heroes. To recap, unlike Crestor, Vitorian, and Zetia, Lipitor has been FDA approved to reduce the risk of heart attack and stroke while lowering bad cholesterol 39 to 60% when diet and exercise isn't enough.
Room 11. Dysuria, painful and difficult urination.
Doctor, do you want to catheterize the patient since the urologist can't get them in for a few days?
I'm not willing to do that because I've never done one before.
I can do it for you. Where are the catheter kits?
What's a catheter kit?
Receptionist desk.
Hey, Janet. Free Starbucks and candy.
Who brought these in for us?
The diabetes reps.
Yes, Mrs. Jones, that one does cause constipation. I'm not sure why the pharmacist didn't tell you. Yes, ma'am. I'm not sure why the doctor didn't tell you either. Hi, Mrs. Miller. We got your CT scan results back. The doctor wants you to come in to talk to him.
I have cancer, don't I? We can't afford the treatment. We don't have any insurance. I can't be a burden on my family.
Hello. We have a patient for emergency admit. Yes. Suicidal. Yes. They have a plan. Yes, also homicidal ideation. What do you mean you don't have anything? What am I supposed to do for them? Yes, very serious. No. Oh, I can't let them go. What? 5 days is too long to wait. I need you to find a room now.
Janet, I need you to show Mr. Johnson how to do a catheter
Janet,
in room 2.
I need you to debride the cellulitis wound in room 4.
If you'd like to keep your job, I suggest you follow my orders.
Janet, did you get those vaginal samples to the lab?
Hey, Janet, free Starbucks and candy.
Janet, you need to go back to school to learn.
Janet.
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 Janet. Janet.
Janet. All right. Well, this is officially episode 3 of True Theater Radio. Thank you, everybody, for coming and listening. It's exciting. We're here with Deplorable Janet from Deplorable Nation. She is
Janet.
Hey, Janet.
Hey.
And she is the main star of our current episode that you've heard at the beginning of this one, and you'll be hearing the epilogue of it, or before this episode and the rest of it. So we'll be talking with Janet and getting a little bit of the background and what she has in regards to the health industry, because that's a super hot topic. Maybe it's so hot everybody's kind of tired of it a little bit, but she has a little bit more insider information before all the world went crazy, and so we have a little bit more of an idea of that. So Janet, why don't you just tell us a little bit about and just to give you a little bit of idea, we kind of try to stick with the whole hour 3 concept. If people don't really know who you are, they got hours of stuff they can go and actually listen to what you're all about. And we just want to hear a little bit more along the lines of kind of more right now. Go ahead, Josh.
Yeah, so I think it's kind of a good idea because it seems like at the end of every podcast I listen to, they're like, oh, okay, go tell people where to find us. You should just tell me where to find you now. So it's like, okay, just tell me where to find you now, and then we can get into it, because once they get through about halfway through the episode, they're going to be like, I got to find out who this woman is, and she already told us. So it's like they can kind of look you up. Which all your credentials are actually going to be on our website anyways. So if they go on our webpage and they see this episode, it's going to be like, oh, well, this is where I can find her. Just click on that, and they'll be able to listen to all your stuff. So why don't you just tell us where they can find you, and we'll go from there.
Well, if you want to stalk me, you can find me at my house. No, I'm just kidding. Don't come over unless I ask you to. I am on every podcast platform, plus Alt Media United and Actual Activists with an S on the end.com, as well as you can find me on Roku TV, exclusive video on Roku TV of every episode, and that is on the Patriot Podcast Network.
Yeah.
So there you go.
Podcast. Awesome.
Mm-hmm.
Sweet. So
I want to know, like, so I just wanted to say, like, for those of you who just listened to the audio drama, allegedly, according to Janet, everything you heard is a true story.
Mm-hmm. 100%.
And so that's why this was a really fun and also written by you, which is fantastic. So it was a very fun thing to put together, and kind of so if somebody's listening to it, they think it just sounds like might be a bunch of nonsense, but it's not. This is what you live through. And actually, I'm staying with a girl right now who is she is a, I forget the term for it. She's a surgeon scrub. Like I think that's what she
Surgical
calls it. Like
tech.
yeah, she's a surgical tech. So she works with the surgeons. And I actually played the radio drama for her. And right at the beginning, when you're talking to on the phone with the people with the medications, and she's like, denied. She said it before she even heard denied. And she's like, oh, denied. And I was like, so she knew exactly what was going on. She's like, yeah, he's denied. He's denied. And it's like the whole time she just knew exactly what was like as she was listening to it. She's like, yeah, this is exactly how it is.
100%. And we would laugh because there were days like where certain insurance providers, especially the largest one that may start with a B, I'm sure you know what I'm talking about. But we would have days that we would say, okay, well, this is their dump day. And so every claim you submitted, for services was denied, every medication, every procedure, literally everything. It didn't matter what it was, whether it was an appeal or whatever. It was always denied on certain days. And it was like, oh, it's their dump day, and so it got to be a running joke, but it is so difficult and it's so time consuming because even though like in the drama, it doesn't do it much credence, but you could literally spend 2 hours on the phone just for one thing, trying to get one thing accomplished.
No,
Let me transfer you. Yeah.
Yeah, I want to know, like, is this just strictly because like I'm ex-military and a lot of things that happened in the military were mostly just paperwork. It wasn't even necessarily like because people had ill intention. It could just be the entire system is set up to where they have to go through step after step after step in order to get to finally what somebody needs. And so I'm like, do you think that like, because basically what you said on your in your story is this, I'm sure that there are some asshole doctors who are extremely cocky and very very arrogant. Yeah. And so, and I actually said this because I've been to the VA a few times and I've talked to the nurse and they're like, oh, let me get the doctor. I was like, no, I want to talk to you. And she's like, the doctor nurse will be like, why? I was like, because you know more than the doctor does. 100%. And they'll laugh. And I'm like, no, I'm dead serious. I've dealt with this enough to know that the nurse knows more than the doctor.
They used to call me Dr. Janet all the time because like especially phone calls or, whatever, patients would call and ask for me just because they knew that I would tell them exactly, what was going on or whatever, or, what I thought something was. And they're like, or tell me things that they sure shit wouldn't tell the doctor. We had that happen a lot.
because I've listened to your show enough times. I'm like, this girl knows what she's talking about. And like, you'll just spout off stuff. And I'm like, I've never heard a doctor talk like this before. This is like, she knows what's up. So,
yeah. And I it's fun because I'm not one of those meek people. And so somebody asked me the other day, they're like, well, did you run into a lot of doctors that were difficult to deal with? And I'm like, all the time. But if you don't speak up, they know they can run over you. And so they'll do it continually. So I was one of those people, as soon as somebody would get out of line, I'd be like, snap my fingers at them. I'd be like, nope, come on in your office. You and I are going to have a chat. We don't do this in front of patients. We don't do this in front of other employees. I'm like, you need to adult more. So, yeah.
So I was kind of curious when you were actually listening to it for the first time, were you having a little bit of a PTSD moment thinking about, thank God I'm not doing that anymore.
It's so funny because like when we were working on this show, there are so many things that happen and so many stories. And I'm like, oh my God, like, how do I narrow this down? Because I could literally write a book about stuff. And things don't bother me so much anymore because, I've been away from it for a hot minute there. But, Yeah, there are some times where, like, especially on movies or shows or something, I'll see something come up and I'll be like, "Oh, I remember that time." Grr.
So when it comes to the actual, it seems like doctors almost have this sense of invincibility to them.
Mm-hmm.
Being inside that industry, how much accountability is there to doctors next to being sued by a patient?
Oh, I have worked for multiple where they have actually had their butt off because of just ridiculous mistakes that they make. And, one of them was kind of talked about in the episode, dealing with the medication issue. But it's like small things, like you can't give patients certain things that are contraindicated for the conditions that they have and stuff. So it was pretty commonplace to see lawsuits flying around. So yeah. And they do. They have this it's like they think they have a cloak of invincibility, right? But that's not the case, because especially with educated patients, and educated family members, it's really hard for them to get away with stuff now that is a mistake.
Can you just define what contraindications mean? I mean, I kind of got an idea of it when I was, and I did look it up, but I just wanted, for anybody who actually hears it, it'd be beneficial to have an actual somewhat of a summary definition of what that is.
It basically boils down to you have a condition, an ailment, an illness, infection, something like that, where you cannot be prescribed certain medications, certain treatments. So it's like counterthetical to your treatment plan. It goes against, like you can't have, like in the episode, you can't have a migraine medication if you have underlying heart conditions or high blood pressure or multiple other things. So,
okay.
Yeah.
All right. And so, at what year did you actually end up leaving nursing? Give or take.
I think it's been about 7 years now. About 7 years ago, and
So pre-sniffles 19.
Yeah, and I'm really glad for that, because I was around during the SARS pandemic, the MERS pandemic,
Did they call those a pandemic? I remember
No.
SARS, but I didn't know if they
Yeah.
called it. I'm just
it
curious.
was an epidemic. Ebola, all that kind of stuff, and so
I remember Ebola.
SARS and MERS are actually worse than the C word, than the beer name. Yeah.
I'm just curious. I'm actually going to ask this, Jonah, because I'm like something I don't know if we've really talked about, but how much are we editing or censoring ourselves? Because we're not really on YouTube.
I'm not censoring myself.
COVID-19,
but I just
vaccines. I'm not playing this game.
I know it's funny. I just like saying sniffles 19 because it's hilarious.
It is funny, yeah. But
because it's so demeaning to what
sniffles,
it is.
Yeah, I just think it's
hilarious.
I just want to make sure that we're clear that, like, you don't have to censor anything.
Oh, good.
We could talk about the freaking Jews if you want to. It doesn't matter. It's just like, and I say this because I have a lot of Jewish friends, so it's like they would think I was hilarious, but it's like we talk about whatever you want, so it's like let's just let it go.
It's always a bonus not to have to
it.
skirt around things and say, well, people got the cookie.
We don't want to do
or,
that. Yeah,
the lollipop or whatever.
Yeah, I joked around that eventually we'd just be sending our podcast out on CDs through the mail. And it would just be like, I don't have to censor a CD.
No return policy like Netflix, okay?
Yeah.
Not that kind of CD policy.
Yeah, we won't do that. You make a copy of it and send it out. Send it out yourself. So.
But like, who has a CD? Who has CD players anymore?
We joke about that all the time, like the tape decks in the car and stuff like that. Yeah.
Yeah. Well, it's going to be like Mad Max, and everybody's going to be looking for CD players eventually. They're going to shut the internet down. It's like, why didn't I save my iPod? You know.
But you know something that I would really enjoy doing, and I don't know if you guys know this about me or not, but I used to be an autopsy assistant. And so
that sounds super fun. We have to hear stories about that, Janet.
So
Are you please tell me some dirty, gross stories on that?
It makes me sound like a serial killer that I enjoy stuff like that.
Bring it.
Like, I love the blood and guts, and that was my favorite thing. Nursing too is like anything bloody, gutty, and gory. That's like my thing. But I would love to be like the autopsy assistant now for shit that's going on after this, pandemic and with the clots and all the stuff that they're seeing. I would just love to dig into people's like brain tissue and stuff.
So you'd like to be the person that's like, this person got into a motorcycle accident, he died of COVID.
Exactly. Yeah. Yeah. And
insane.
That's a big thing because like before Twitter absorbed the video stuff that used to be called Periscope. And so I kept telling people on Periscope back in the day, I'm like, well, anytime they call something an epidemic or a pandemic, they get more funding, they get more money. And so they're like, well, why are all these, deaths being ruled COVID when it was a motorcycle accident or somebody jumped off of a cliff or whatever? I'm like, for money purposes, because if they can code it as COVID, they get thousands of more dollars. So,
so crazy.
Money.
I mean, those of us in kind of the truth community, we know this. It's like you tell this to people in the the normies in the regular world, they look at you blank faced. They don't believe any of that nonsense. And so it's like we kind of stick to our crew, our group. Like I'm talking to you. We know who we can talk to about this kind of thing.
Right.
But it's like we listen to it, so we know this. But and I think one thing that's happened it's certainly happened to me is this whole nonsense, I think, has brought a lot of us into a much higher spiritual plane.
Absolutely.
Because we can see the clown show now. It's like it's so obvious. I mean, 9/11 was kind of one of those things that kind of woke us up a little bit, but it wasn't didn't have the same impact as what happens with, okay, the whole world's going nuts. Let's kind of get through this, and now we're kind of waking up, and everybody's like, okay, now what do we go with this? So we can sit there and laugh about it. We can poke fun at like why they're doing it, but I think that it's kind of like I've gotten to a point where I realize like the why they are doing stuff is not relevant to me anymore.
Right.
I think that's where we are. That's where we initially all need to get to. It's like why they're doing it doesn't matter. I don't care if they're doing it for money. I don't care if they're doing it for power. I don't care. I'm done. I don't give a shit anymore. I'm over it. Fuck it. I'm done.
100%.
Now I want to talk to people like Janet. I want to talk to the people legit bad. I want to talk to everybody else who we want to eventually make a radio show about, like, or do a radio drama about, and then create our own little ecosystem of, okay, we got it now. Let's have fun now. To hell with it. We're done. We get it now. Because we can sit here on podcasts every freaking day. Like I said, this is like hour 3. We can go through podcasts every time, talk about all the problems, reasons why everybody does everything. But we're not actually getting to, okay, what are we really doing? Like, are we getting something from this? We need to, like, our spiritual self needs to get to a point where, like, we can all literally just look at this almost like we broke down the fourth wall and now we can laugh at it. It's nonsense. And so that's why I love listening to you on your shows, because yes, you talk about a lot of serious issues, but then you'll also talk about how you shit your pants on the freaking
exactly.
And it's fucking great. It's like
anytime I'm around Joe and Jen and Ben, that always happens to come back around to poop. I'm telling you.
They're so great, right? They're just hilarious. I love them.
One of them, I think we actually should have called it the poop episode because it was all about poop.
So doing autopsies, because that kind of sparked my interest a little bit. How much? I mean, we most of the time when we look at people doing autopsies, we get everything. All of our information usually comes from Hollywood. It's like they crack the guy open, and all of a sudden they see some speck of everything, and they solve a case or something like that. How realistic is it when you're doing autopsies that you're able to really pinpoint it, or is it more of like kind of like a in the ballpark of what actually happened to somebody, and how much of it? I guess I could even ask, what's the craziest scenario you've had where you're like, oh my God, he's got they inserted an axe inside of his body chest before, whatever, I don't know, something.
Yeah, so I want to know,
the craziest.
I was just wondering, like Janet, are you like the real Agent Scully from the X-Files?
I am, because you know what? Like my favorite show on the planet is Forensic Files. So if that tells you anything, being working.
I love that show. That's awesome.
And it is kind of sort of true to life, because you do cut open their chest, you crack open their ribs, you cut their skull off, you peel their face down, so you have to cut sections of like the brain matter or all of the organs. You have to weigh them and size them in the whole 9 yards and cut sections out of them, and that's where you find if there's cancers or other things like poisons that would change the cellular structure and stuff like that. I will tell you the grossest thing that I ever had to do was a burnt body. You never ever forget the smell of burnt flesh. I swear it was stuck in my nose for like 3 months. It didn't take me long after doing that to learn that if you kept a jar of Vicks with you and put Vicks inside your nostrils before you cut somebody open, that was a smart idea. Because I've had people that, were assisting that like cut the bowel, and that is, again, back to poop. That is the worst smell on the planet, is that just like festering, decaying, rotting turd burglar in there. It's gross. Yeah.
Oh man, because I'm sure it takes a certain type of person not only to be able to do that I mean, forget about the fact that it's a human body. Just dealing with anything along the lines of it being, anything that's gross or having very pungent smells. Some people can't even be, within a block's radius of anything, and before they're wanting to, throw up on their shoes.
We had a lot of people throw up or pass out. Yeah. There were people that, we were training to help us in there that couldn't hack. But same thing, with nursing is, especially teaching the doctors and stuff. And I remember one time we were doing a toenail removal with this very conceited student doctor. And I told him, I'm like, do you have a fear of needles? And he's like, no. And I said, okay, good. I said, hopefully you'll be able to get through this procedure, right? So you have to.
I'm already picturing a needle go into a nail. That's
not in the nail, but usually it's in the big toe, right? And so they would give you a block. And so what they would do, they would take lidocaine in a needle with a very large gauge needle, and they would stick it like between your big toe and the toe next to it. And then you'd also get one, in the bottom of your toe and whatnot. And just seeing people get that shot, because it hurts like a mother,
Yeah.
And so just seeing people get that shot, this doctor went, pew, poof, like timber. And I was like, ha, ha, ha.
Yeah. I keep getting that image. Have you ever seen? It was probably one of his worst movies, but the I think it was Leslie Nielsen movie, Dracula Dead and Loving It. And Mel Brooks actually plays the
so this
plays
is
the doctor.
old. This is like 70s.
Well, this is actually I think like mid 90s. Actually, it was Dracula Dead and Loving It. Leslie Nielsen was the vampire, was Dracula, but Mel Brooks was like a guest star in it as like he was Van Helsing. Now that I remember it, he was Van Helsing, and he was teaching other doctors to do autopsies. And in one of these, obviously spoof slapstick scenes, Van Helsing, Mel Brooks, his entire goal was to make every single doctor faint on their ass, and so he's just making it more gross and ridiculous and just ripping the guy's guts out.
How have I never seen this movie? Now I know what I'm going to watch tonight. I'm watching that movie tonight. That sounds ridiculous.
Look up Dracula just for that one scene. You should watch just for that one scene doing the autopsy.
I would love that.
It's like he starts off with like. He's like cracking the guy's skull open. The one guy faints, and then the guy's like, "Oh well, let's just see what we got here." And he rips open his case and starts ripping his guts out and blood's going everywhere. Yeah, you got to see it. It's freaking hilarious. It's like right at the end, he's like, "Still got it." After they're all on the ground.
Okay, now I know what I'm watching. This sounds so ridiculous.
That is absolutely excellent, because you have no idea how many times during my career that I thought about that. Like, what can I do to gross somebody out the most today?
Because listening to your show, like a lot of the guests that you've had on, I've listened to a lot of things, and you'll talk about some pretty intense shit. And I'm like, who is this fucking woman? Like she's seen things that I'm like, I've been to war, and I don't want to see the shit she's seen. I don't want to see that stuff.
That's how you know, like in nursing school, that's how you know who is and who is not going to make it, like literally within the first couple of days.
I can imagine,
especially when they start clinical rotation, because they're like, oh God, I have to deal with poop. Oh no, I'm not. Yeah, I can't. I can't do that. I can't bandage a wound. I don't want to see blood. Well, what do you think you're doing?
Why don't they just do stuff? Why don't they just do that stuff right off the bat? It's like day one of nursing school.
Got to do all that important
Bring them in to do some
first.
nasty ass shit. Yeah, it's like just go in there. I mean, it would weed out a lot of people wasting their time if you just brought them in there to do something that was just really off the wall gnarly.
Well, most people
just
like I always got stuck with the cadavers, all the dead bodies, because nobody else in my class when I was going through school could stand to be around a dead body, and I'm like, why? They're dead. They're not going to bother you, but some people, like, it just freaked them out so bad, and I'm like, you're really in the wrong profession then, because you're going to have a lot of people die, and you just got to get used to it, and then you got to clean up their bodies afterwards so you could present them to their family.
Yeah, because it's not even really the same, but it has a lot of similarities where I did apartment maintenance for like 10 years. And everybody, when you hear them say do apartment maintenance, you think you're fixing people's garbage disposals or their dishwashers and stuff. I have had to deal with some of the nastiest shit that most people would not be able to even come close to even being in that area, much less having to actually get their hands dirty.
I can only imagine some of the things you saw.
People are people are
gross.
People are gross and they're freaky.
You know who's the grossest? Women by far are the grossest.
Oh, let me tell you, I used to be I was a bartender for years, and when you go clean the women's bathroom, oh my God, it is like a nightmare. It's like, it looks like a horror movie. It smells like piss, and there's blood everywhere, and it's just the worst. There's vomit. It's terrible. Oh my God, it's the worst.
While they were standing up, air pooping over the toilet. Yeah.
And like every time I went to the men's, because when every time I go to a men's bathroom. I was like, gross, there's piss everywhere and stuff. And then when I bartended, I went into women's bathroom. I was like, oh my God,
There's
these
so much
pretty
worse.
little princesses.
Yeah, no.
Nope.
Women are so
Nope.
nasty, and that's why, like, we get a chuckle, like, anytime we'll go somewhere, and I'll be like, "Okay, I have to go to the bathroom." He'll be like, "How gross was it this time on a scale of 1 to 10?" It's like, "Okay, that one was, like, past a 10, like, nasty, like, there's clots hanging
Yeah.
on the wall." Gross.
Ugh. God, I know, it's so gross. It's
You know,
so
both of you are
gross.
going,
Yeah.
"Bleh, bleh."
Yeah, but that's actually what I actually had, because my youngest, my 6-year-old, I was actually one of the few, because the doctors made a point of it, and I was one of the few, because my wife had a C-section with him, and I was one of the few dads that not only watched it but recorded the thing.
Wait, I didn't know she had a C-section.
Flinch.
That's was a C-section baby. You watched this?
Yeah.
Oh my God, I'm getting
Oh yeah, I
thinking
watched
about
the whole
it.
thing.
Jeez, man, I had no idea. That's crazy.
Yeah.
Yeah.
So I mean, I'm actually one of the few people that can handle that kind of thing, and it didn't faze me at all. It was just, I was just like, whoa, that's pretty interesting.
I loved stuff
You
like
know,
that.
so-
Like, we did so many surgeries and stuff at the teaching hospital, and we'd have people that come in that, like, you know, cut their fingers off or whatever, or toes off with sheet metal and stuff like that. And I'm like, oh yes, that's like my favorite thing. It's like Halloween every day, you know. But most people are like, anything bloody, gutty, like they can't stand it. Like they want to trade me to do it because they couldn't take it. I'm like, that's my favorite. Of course I want to do it.
So that's
I am not a
kind of-
serial killer,
so,
repeat. I am not.
Like, this is like, you're not what?
And what, you were cutting out there for a
Oh,
second.
me?
Sorry, did you lose me?
Oh,
No,
okay.
Josh.
No, you might have lost me. Sorry, I was gonna
Yeah, you're
ask me
cutting
what
out
you
there.
like. Am I still cutting out?
Slightly.
Oh, okay.
Just
Well, you talk.
do a test here real quick. Well,
All
I
right,
was just
test
okay.
that.
So I was just gonna say to veer slightly off of the guts and gore topic a little bit. I actually heard in one of, I don't know how recent it was. I think I was just kind of scanning through some of your episodes and listening to some of them, and I don't remember who it was with, but I remember you were talking about you hold to the terrain theory a little bit. I don't know if it's changed since I've listened to that episode, but you hold a lot more to the terrain theory than maybe germ theory.
100%.
And that's starting to be one of these things that people are really starting to call into question, is the whole germ thing. And I know for a fact, I can tell you from my own personal experience, especially being in the apartment maintenance industry, germs never made quite that much sense to me, because I was one of the guys, I hate working with gloves. I
Right.
can't stand it. I don't care what kind of gloves it is, whether it's latex, rubber, leather gloves, it doesn't matter. You can't have a real good
Right.
feel for what you're doing when you have any kind of gloves on of any kind. And I'd change people's toilets, I'd unclog people's toilets, I'd pull out wads of
He's pulling
out of girls'
dump
showers,
out of the toilet.
you know. Yeah, I'm just like, and people are like, you're not going to wear gloves? I'm like, well, I'm not going to lick my fingers. If that makes you feel any better, I'll make sure I wash.
Oh, dude,
But
do you
I mean,
remember? Do you remember that time we were joking around in your van, and we were like, you should like, after you're done fixing somebody's toilet, somebody walks in that actually is working with you, and you just like, I'm all done, and then just start licking your fingers, like,
yeah, I'll just like start. I'm all done here.
Just to fuck with people. That'd be
It's a
so funny.
Yep. Yeah. I thought of all kinds of twisted stuff to do to people like that, just to mess with them. But yeah, no, I mean, I couldn't stand working with gloves, and it seemed like I didn't get sick hardly ever. Like even in general, I don't get sick very often. My whole family can get sick, and I'm perfectly fine. I do get sick. I'm not saying I'm some kind of, I have some kind of perfect immune system, but I seem to not get sick very often. And if there was anybody in my family that should have been sick all the time, it was me. and it never
Right.
made sense. It's like, oh, there's germs on everything. I'm like, I
Right.
guess,
And it
but
doesn't. And
you
and
know,
the thing is, you know, when they indoctrinate you through school, of course, it's all about the germ theory and how everything is so contagious and there's bacteria and there's viruses and everybody's going to die from all of these things. And I'm like, actually, no, because that was developed um, by Pasteur, who was a political stooge. And so that is when the terms infectious and contagious and pandemic and all of that stuff came along. Now, how long has society actually been functioning? Long before that, right? And people were
Isn't
living
the
in
Pasteur where pasteurized milk comes from? Like with the word
Mhm.
pasteurized milk?
Yes.
Is that where that comes from? Okay.
Yes. And so it's kind of like Edison, right? Where they touted him as the, the father of electricity and all these theories and all this stuff. Pasteur was the same way. None of the things that he came up with were his own. He stole the research from colleagues, from secretaries and stuff like that, but they propped him up because he was part of the political party. And so they put him forth as the, be all and know all for the germ theory, which, if you think about it, how many times a day people come in contact with quote germs, right, on any kind of surface, and in the grocery store, on a shopping cart, or the little keypads that you punch in your number for your pen for buying something or whatever. You would think that people would be deathly ill all the time if that theory existed. However, um, the only thing that makes you sick are toxins in the environment, and it is because your internal environment is ill. It is out of balance. Your pH is out of balance. Your body's not in homeostasis, so it means that your natural immunity cannot fight off the toxins that you encounter on a daily basis. So it has to do with your internal environment, nothing from the external environment.
wow. So my wife might get a little irritated by me asking this,
Ask away.
because she if anybody in the house is like, my throat hurts a little bit, in comes a case of Lysol sometimes,
No.
and we start spraying shit
No,
down.
no, no.
And I'm like, I don't think that's really that necessary.
That is a tell her that is a no, because that is actually full of chemicals and heavy detergents and things that are very toxic to the human body and the human tissues. So anytime you touch something you've sprayed with Lysol, and I don't know how old your kids are, but say they touch it and they put it in their mouth, you're taking in toxic chemicals in your mouth because of surfaces that you touched, because that stays on surfaces, and it's not like it just magically disappears. That
So would you say there's any place for Lysol
no.
ever?
Mm-mm.
So it
That's a
shouldn't
bold
exist.
statement. Like
Yeah,
I
no.
like hearing. I'm very fascinated hearing people say stuff like that because it's like because we disinfect everything in this world. It's like everything gets.
Yeah,
Which
America,
makes you sicker.
even though we've got some gross, yeah, we may have some gross Americans, but as a whole, we tend to be a little bit clean freaks. I would say sterilization freaks to some extent. Even before this whole thing with the COVID and all that stuff, it seemed like everybody was always, oh, there's
Right.
germs here, touch this. Oh, this kills 99.9999999% of germs minus the one that'll get you sick tomorrow. But either way, we were constantly cleaning stuff all the time. And I've heard a few arguments against that you're actually destroying yourself a little bit more by trying to be clean all the time.
100%, because that your body's natural immunity is going to help you fight off any toxin that you come in contact with. However, if you are constantly using things like that are known carcinogens, cancer causing agents, right? You're putting that inside your body and you're overwhelming your system with all the toxic chemicals that come from not only like Lysol, but dusting spray, dishwashing liquid, things like that. And so if you buy things that are natural instead, you're not going to get those toxic carcinogenic, you know, um, elements that you do with the chemical solvents and cleaners.
Okay, so with the world that we live in right now, like the world that we've been living in right now, where a lot of people have been coming up to question, because I think what has happened with the powers that be with this whole COVID-19 thing is people, for the first time that I've ever seen, normal, like the normies started asking, like, what the hell are you talking about? Like, they started like, this doesn't make any sense.
Right.
You know? And so because of that, even a person like me, who, like, I use the VA hospital, which the VA has been good to me most of the time.
Right.
So a lot of people, I think a lot of people from every podcast I've ever heard from either anybody in the medical field, they never ask this question. This one I'm going to ask you.
Okay.
Is if clearly Western medicine has value, a lot of value. Like, if I break my arm, I'm not going to go to the holistic doctor down the street and give me acupuncture. I'm going to go to the hospital, and they're going to bend me up. And so I don't know if you might have an idea of where is the line for people that want to, because obviously if the terrain theory is true, which I'm very apt to believe, I mean, I believe that the terrain theory is, and I don't really, because the word theory clearly defines that it's not proven.
Exactly.
But based on the evidence that we have right now, the germ theory is kind of bunk.
Right.
We just know that. It doesn't make sense. So it makes more sense that our terrain, our physical terrain, even our external terrain will affect our health. So if somebody feels like something's a real problem, where is the line that people should avoid the hospital, or when they should, it's time to go to the hospital? Do you know what I mean?
Okay. That one's an easy one for me because this is how I live my life. Because coming from the medical system, I don't trust the medical system for shit. So if
tell me how you feel, Janet. Tell me how you feel.
Just being honest.
Right.
I will not go unless it is something that I cannot fix myself. That being said, like I had back surgery done and a spinal fusion. I certainly couldn't do that myself. So yes, that would be a necessary thing. If you, the one thing that concerns me anymore is with what we see coming out in reports about people that have been vaccinated and what their blood is like, right? If you go in for any type of major surgery where you're going to have to be given blood, you need to make sure that you self donate before you ever have that procedure done. Because the problem that's coming up right now is, since this is a gene therapy, right? And it's changing people's molecular structure, changing their DNA, changing what their blood cells look like and how their blood cells carry oxygen on a normal basis. If you are not vaccinated and you go and get blood that was given by somebody that is, that's all the more opportunity for your blood to not be compatible and for you to reject that and to have a reaction to that blood. So if, surgeries, definitely you need to go not elective surgeries, but actual, like, your head was almost lopped off, you chopped your arm in half, something like that. That is definite. But colds, you know, haha, wink, the flu, um, allergies, anything that's small, you can always treat it yourself. And there are lots and lots of different herbal remedies, essential oils, things like that that you can do to take care of your
Yeah,
problems.
I think the reason why I'm asking, like, I'm sorry to cut you off. The reason why I'm asking this is like, a lot of us in the truther community,
Mhm.
including myself, have this kind of moment where it's like, okay, I don't trust the medical system,
Mhm.
but I don't know how to fix this at
Mhm.
all, and I'm in a lot of pain, and
Mhm.
this needs to get taken care of as soon as possible.
Mhm.
Like I think when we talked to the phone, I said I have to go to the dentist because my teeth
Mhm.
my one of my molars was in a bad way,
Mhm.
and the dentist, she just immediately was like, "Oh, we just gotta pull it out." I was like, "Well, my arm's bothering me too. Do you need to rip my arm off?"
Let's
You
just
know?
chop it off. You don't
Yeah,
need
like,
it. You got
I'm
another
like,
one.
no. What's so? I'm My question is like, do you have any advice to people of where the line is? Of like, I know that that's vague because where a person's health is different from one person to another person and from
Mhm.
everybody else. But a lot of people are, especially in our community, are kind of like, we want to know. There's some moments where it's like, okay, yeah, I just got in a car accident and my femur bone was popped out of my leg. I probably should go to the ER,
Right.
you know.
Absolutely.
But a lot of people can be like really sick, and I think a lot of times people like they just immediately want to jump to the hospital, and they don't really
Mhm.
know like, okay, you could have fixed this with X, Y, or Z.
Right. And that's the thing is because we were conditioned from a really young age, right?
Right,
To
right.
trust doctors. And if something's wrong, go to the doctor. Even if it's for the sniffles or whatever, people automatically run to the doctor's office for that. But here's the thing, we have a world of technology at our fingertips 24 hours a day, 7 days a week, right? There are places that you can look for holistic herbal remedies to fix literally any problem that you have that doesn't require a major surgery. And so, whether it's a dental problem, whether it's depression, anxiety, colds, allergies, anything like that, there's always remedies outside of the healthcare system, and they're readily available to look up on the
Do
internet.
you have any sources or like people that you would recommend for people to go to? Because like obviously the whole reason my brother and I started this podcast.
We're not going to
Yeah,
Yeah, we're not
no.
going to WebMD. Yeah,
basically.
yeah. The whole reason why my brother and I started this podcast is like we're we're in the camp of we're not necessarily doing this for us. We want like oh well actually I take that back. We are doing this for us because we want to know. I want to know where to go because it's like I can't just email every freaking podcaster I've ever listened. Like I want to talk to them and like let's figure this out. And I want other people to ask the questions that we will ask. And a lot of people say, "Oh, well, there's all these remedies of this and that's like, okay, fine. Where do I go? Tell me. Where do I go? Give me a website. Give me a
Well,
person.
okay.
I want to know. You know."
Here's a You can get the Ultimate Guide to Essential Oils. It's a book. Hold on a minute. Let me grab it off my shelf here.
Yeah, because I'm all about promoting other people's work if it's good. I don't care. I don't want to make money off it. I want to know
Okay.
I want
This
to know the information.
this is the Ultimate Guide to Essential Oils, and it's from Kimberly Keniston Pond.
Pond? Is that
Yes,
POND?
POND. And anyway, it's a complete reference guide to the amazing healing powers of essential oils. Now, I
Okay,
will
great.
tell you, because I'm very big into essential oils, you want to make sure if you're going to use them, you get therapeutic grade. That
Therapeutic
means
grade. Okay.
that they are high grade with no impurities. They're 100% pure from farm to seal. There are a couple of different companies that I buy oils from, but one of the, hold on just a minute, and I'll tell you what the name of the other book is. Bear with me
Great.
just 1 second. And it is a book of herbal remedies for like plants and herbs and things like that. Let me see if I can find it.
Sweet.
Okay. It's
Yeah,
not
because I mean,
there.
I
But there's
think a lot
like
of people
the there's one I just ordered another one and it's not here yet, but I can't remember the guy's name. He was like one of the very first holistic doctors of this century and was shut down and then miraculously died of suspicious
Oh, isn't that
causes.
funny how it works? You got Epstein, huh? You got
Um,
Clinton.
he has a book. I can't. Oh my god, I'm having total brain fart of what his name is. But there are books that you can look up. And what you need to look up is holistic and herbal medicines. There are websites that are just for that. Or
Right.
you can buy books that can tell you like how to make your own tinctures and things like that that you can use instead of turning to Western medicine pill
Yeah.
popping. Yeah.
Have you heard of the like, because I've been listening to a lot of different podcasts. Have you heard about George Weissman's Brown's gas?
Mm-mm.
You haven't heard of this?
Mm-mm.
So okay, so this guy named George Weissman, I'm not going to get too far into it, but he invented a hydrogen machine that basically you breathe. And his claim, you do you listen to Crow 777 at all?
Mm-mm.
Okay,
No.
well, there's a few podcasts where it's like, but there's this gas, this hydrogen gas that he claims to practically heal everything because we're hydrogen deficient.
Right.
And I would imagine like these essential oils are the kind of thing that are bringing back into the body that in our Western culture we're so detached from nature,
Right.
that realistically all these things like that we should be getting on a daily basis, like we should like on like in springtime everybody should be eating dandelions. Hey boomers,
100.
listen to what I'm saying.
I love
Hey boomers,
dandelion.
stop,
That is my favorite.
stop cutting your dandelions, baby boomers. It's food. Stop doing it. It's medicine.
Mhm.
Stop getting rid of your dandelions. It's the best thing in the world.
Yep.
And so it's stuff like that that we've lost this connection.
Mhm.
And so basically what this machine does is it kind of like, okay, well, since you aren't going to do that, let's reset that and do what you're supposed to do and get all the hydrogen from what you're getting from all this plant life that you should be getting naturally. And
If
so
you
they
were
don't,
outside actually breathing the air instead of sitting on your butt in front of the TV or
right.
game console. Yes.
Yeah.
So that actually brings up a question. How much illness would you say, with your experience in the medical industry, is psychosomatic?
That is a tricky question.
Ballpark
However, what I'm
percentage.
going to say on that is that people that suffer from depression or anxiety or are diagnosed with ADHD, that is the largest group, right? And I think a lot of that is situational stuff that if you remove toxic behaviors, um, bad diets, things like that, those would not be an issue, would not be a problem. And so what we're seeing is a large instance of increase in those particular populations. And so I'm going to say, out of all of the people that are diagnosed with that, I would say probably 80% of those people, it's up here.
So, well, just to veer off again, we've been talking a lot about health and things like that, and there are countless podcasts I've heard in regards to what people have and talking about health and going natural. Everybody's kind of getting that vibe right now. And while we still have the medical industry, thank God they're there in case I do lop my leg off.
Right.
I'm still really grateful for what it is. And, we can go on and on about, what health insurance is. Can't stand it. I think that's a whole money grab.
It's a scam.
At the end. We know all that stuff. What I was kind of curious, especially after doing the dramatized portion of the show, is how much of that on a day-to-day basis were you seeing behind the scenes that was just shady business? Like, how often was that just like, oh, I saw something last month?
Oh no,
was it like on a daily
it's
basis
literally all the
stuff?
time, and it's a whole host of things. Okay, it's people lying on documentation. It's people stealing patients' medications. It's doctors not reading the patient's chart and prescribing things for them that, again, they should not be taking because it's contraindicated for whatever is going on with them. There is what they like to call upcoding, right? So I also
Define
did.
what's upcoding mean?
Okay. I did
Sorry,
billing and coding for a really long time too. So I've seen like every aspect of the medical industry that you could possibly imagine. And so like say a patient comes in for an office visit, there's just different levels of office visit, there's like 1 to 5 on visit levels, and it all depends like how much time you spend with them, how in depth the appointment is or whatever. And so upcoding is when you should be charging somebody for the very basic visit, and then you turn around and code it instead as like a level 3 or level 4 because it's more money. So not only can you charge more money to the insurance company will pay a higher rate. So that is a common procedure where they upcode for stuff, or the price of an aspirin should be like, I don't know, 20 cents or something. But instead, we build the inflation in that and upcharge that medication. And now that one little tiny aspirin costs $12. So there was wrong diagnosis of patients all the time. So diagnosis coding is a big deal. So there was wrongdoing of that. There was wrong billing, billing for things that you never did. And so there was a lot of falsification of records, falsification of charts, or people like you guys have a buddy that you went to high school with or something, and say one of you works at the hospital. So you want to access your friend's records and see what's going on with them, even though you haven't seen them since high school. That's not allowed either, because that's private, protected, privileged health information that you should not have access to because you're not working on his case. And so there was a lot of things like that. There was a lot of things in the electronic medical record system having to do with medications and stuff like that, and filing for medications for patients that weren't actually getting medications. There's a lot of fraud that goes on. A lot of undereducation of staff, and so very terrible mistakes being made. And think about this, right? If there really is a germ theory, I have seen doctors and nurses alike both do this, and it grosses me out. Sticking somebody with a needle and then taking that needle and sticking it into the bed, into the mattress.
Get out. Why? Why would they do that?
They don't want to get stuck. So until they have time to put the safety cap on, that's
Okay.
what we do. Or think about this, okay? If germs really exist, you're really sick, you're in the hospital, you need an IV, so they stick the IV in your arm and then they put, tape over it and stuff. So before they get to that part, the nurse pulls the tape off and she sticks it on the bed rail. Or she puts it on her own arm before she sticks it on you. I'm serious. Think about these things.
Are you serious?
So pay attention. Like anytime you go in for like a checkup or something, watch how they do blood pressure. And here's the thing. I would always like whack my students on the hand for if I ever saw them doing this. When you're taking somebody's blood pressure, you cannot put your thumb on the stethoscope because it is picking up your pulse. You have to hold it like this with the bell in between your fingers. If you do this and put your finger on the bell, you're picking up your own pulse, not your patient's.
Weird.
Mm-hmm.
Yeah. Huh.
Yeah.
That's crazy. Yeah, actually, it actually reminds because me and my wife just did this cooking competition, and I'll
Which they won. Congratulations.
Nice. Congrats. I love food.
Yeah.
What'd you make?
Well, it was supposed to be a kind of a mock version of the show Chopped.
Oh, I love
I don't know
Chopped,
if you've ever seen that. So yeah, they basically give you a random basket of stuff, which this year happened to be a whole duck, and it had like pork rinds and some kale and like mustard greens or something like that. Yeah, we basically made like an orange honey, pan-seared duck with a pork rind crust on it. But that's all. It was pretty good.
It was
and we
very
did win.
Good. I had
But that's beside the point I'm trying to make here. I just wanted to say we were in a competition, and I really stink at the whole, taste the food with the spoon and then throw the spoon away. I'm almost taking my pinky and just dipping it in the stuff and licking it.
Are you really doing
that? Tastes pretty good. And I'm being a little facetious, but my wife, I was like, I would touch anything, and we're in this public area, and I'm like just about to re-dip the spoon in there just to try it out, and she's like, no, and she like slaps my arm away from it, and she's like, what are you doing? She's like, you can't put that spoon back in there. And I'm like, I am not used to this. I'm used to cooking at home.
Thing, though. I mean, because think about that. If there were such thing as germs, right? And a lot of people, when they're cooking, they'll have one spoon and they'll taste something. So it's been in your mouth, which is supposed to be full of bacteria, and then they stick it right back in the food multiple times. So that would mean you're spreading all your bacteria to whoever else is eating your cooking, right?
Yeah.
It's this.
Yeah.
Oh yeah, I mean, there's all kinds of nonsensical stuff about it that's always bugged me about the whole germ theory thing. It's like if it was this bad, we should have been dead. 100%.
And think about like one of the dirtiest things in your house is your TV remote, okay, or your phone screen, right?
It's dirty for many reasons, not just germs. Get rid of your freaking remote. Get rid of your TV.
That's what Kleenexes are for. No, I'm kidding. So if you think about like how many people touch that, and then how many times people touch their face or their mouth or whatever, or kids are slobbering on all over their fingers and then touching the remote and they put their fingers back in their mouth. Now, wouldn't you think that everybody would be deathly ill?
You'd think.
That's why it doesn't exist.
Yeah. It's an amazing point right there. Because like there are so many things that people touch on a daily basis. It's like if that was true, we would all have Ebola.
Right.
Like we would all have Ebola. We would all 100%. Be dying.
Which I ain't gonna lie. Ebola terrified the shit out of me because I remember doing a report on it when I was in school about what Ebola did to you, and I'm like just thinking, is this thing like liquefies
you
you from the inside, and I'm like, sounds like something like
Yeah.
a horror movie. I'm like, I
you
don't want
want to hear
nothing to do with
something
Ebola, man.
fantastic
I'll
about
take
that?
COVID any day.
Are you ready for this?
What's that?
Okay, so you know how like they were working on the vaccination long before this pandemic
Yeah.
ever hit, right? So on the Ebola front, one of the things that has been hinted and whispered about is that on the horizon we are going to have hemorrhagic fever, which means you literally bleed from every orifice in your body. It is akin to Ebola. So if you look up the treatments and vaccinations for hemorrhagic fever, the government already owns all of the monoclonal antibodies and all of the treatments, and they've already been working on an injection for hemorrhagic fever. So there you
Jeez.
go.
Oh man.
It's all about patents. It's all
Exactly.
patenting. It's all
100%.
patenting nonsense.
Yeah.
Jeez.
Yeah. 100%.
Unbelievable. But actually, this is something I kind of do want to talk because it's just back to something you said way earlier,
Mhm.
and I think is extremely valuable because it's something I it's something that's
Everything
kind
I
of
say is extremely valuable. Are you
okay.
kidding
Of
me?
course it is, Janet. Of course it is, Janet. Yeah, it's something I haven't ever heard you say, and it's something I haven't heard anybody say, and I think it's we need to bring it back to that because I think it's important. Because my brother asked about how many things do you think are psychosomatic, and you said that had a lot of ties to illness, has to do with anxiety, depression,
Mhm.
and all these other things. And I've noticed something, and this is something that I've noticed in myself since kind of waking up, you know, to becoming kind of a truther is like I've noticed I've actually become far more of a hypochondriac, not because I'm afraid of germs, but because I've become very aware of my mortality. And I'm starting to like, it's kind of like, it's the first time in my life where I've been like, oh my God, this is so exciting. I don't want this to end. You know, it's I'm like, because when I was in Iraq, I was like, whatever. It was just like, okay, it's just life. But now things are getting interesting. Okay, the world is getting interesting, and so, but when I hear about this, when you're saying like people who are depressed and people who have anxiety,
Mhm.
that causes a lot of problems because they are because it is that so and so the mind precedes everything.
Right.
And so when I'm having like I've never noticed my heartbeat until 2020.
Mhm.
Okay. Now I'm like I wake up and I'm like, what is this thing in my chest that's pumping? It's weird. It
You're
weirds me
thinking
out.
about it now, whereas you
I know.
didn't think about it
I
before.
never thought about it. It's so strange to me. And so I'm like, I'm feeling my heartbeat, and I'm like, what if that just stops? It's like it's so weird. But
It'll stop when it's ready to stop.
yeah, but I'm like, am I ready for it to stop? Damn it. I don't want it to stop when it's on my time, you know? And so I'm saying with the anxiety thing, I was asked, the reason I brought it up is like, do you think that part of the, I guess, population control could have been the majority of what has gone on with the COVID, or as my brother likes to say, Sniffles 19,
Mhm.
has caused so much anxiety that is actually what has caused a lot of death. If it's like when like I remember when what was it? SARS, like it came out, or like the bird flu.
Mhm.
Nobody cared and nobody gave a shit. Everybody was fine. But when this thing got pumped out into the world, I don't think people died from it, as they say, but I think a lot of people did die from anxiety. They died from depression. They died from anxiety. Like they died from all kinds of different things that were coming in. It was all actually psychosomatic.
Mhm.
Like that was the spell that was placed on the society. And so I think it's something that, based on your, because I'm assuming that since you were in the medical industry, you probably saw a lot of people that probably could have lived if they just changed their mindset about where
Mhm.
they were at. You know
Right.
what I mean? And
Right.
so that's why I know I'm talking a lot, but I'm asking you because I think this is extremely important. Like, how can you think people can actively change their mindset in order to make themselves healthy?
Well, and here's the thing with that, there are a lot of contributing factors that we do on a daily basis in our routine, right?
Mhm.
So, how much screen time do people use? You are exposing your eyes and your pineal gland to fake uh, ultraviolet light, right? UV light, blue light, whatever you want to call it. So it is magnified. The things from our devices is magnified, right? And so what that does is change your brain, changes the way that your neurons talk to each other, changes the way that you produce hormones and chemicals and things like that. And so when you're getting a ton of blue light from your screen and you're not getting sunlight, um, when you have a habit of bad sleeping, right? You don't get enough sleeping in, and because you're watching TV and then you go to bed too late. And then you toss and turn all night because you ate a bunch of sugar during the day. So there's like a ton of different contributing factors that put our body in a state of off balance. And so what it does is produce more of those chemicals, which are going to make you sad, depressed, irritated, anxious over literally anything and everything. Or sometimes for people, it is situational anxiety, like they've had a bad experience with a certain person or something. And so then, whenever that kind of situation presents with someone else, they have a panic, right? They have a panic attack. And it's all about the way you process those memories in your brain, because we store negative energy, negative thoughts at a cellular level in our tissue. And so if there are issues of like childhood trauma or sexual assaults, things like that, any kind of something that's a upsetting situation for you, and you don't deal with those emotions, or you deal with those in a negative way, that stores at a cellular level, which again changes your chemical makeup, which causes you to not sleep, causes you to have frequent stomach issues, upset stomach, or you feel like you're going to vomit all the time, frequent headaches, things like that. Because another factor to that too is people sitting in the dark, right?
Yeah.
There's a thing that you can do to uncalcify your pineal gland. It's called dark therapy, but it's not recommended for people that are struggling with anxiety or depression because it puts them in that mood. So if you're one of those people that always sits in a dark room and you're on your phone literally all the time, or you never have any lights on in the house, or you always have all your curtains pulled or whatever, you're exposing yourself to dark therapy all the time, which is not a normal thing for us,
Okay.
because we need that balance between the sunlight and the dark,
Mhm.
like the moon and the sunlight, to make our diurnal clock run like it's supposed to.
Right. I'm really glad you brought this up, and I'm going to allow my beautiful brother Jonah to explain why we are an audio only podcast based on the screens. So please take it away, Jonah.
We are an audio only podcast because people look at their
Yep.
damn screens too much. We like one of our biggest things when we would listen to audio drama specifically was, this is awesome because not only can I do whatever I want while listening to it, I'm not staring at something. At this point in my life, I've gotten to the point to where the only time I ever enjoy watching anything is when I'm with my wife before I go to bed. Because I know my body,
Exactly.
and I know that goes counter to what you just
should
said.
not do it right before you go to sleep.
That being said,
no, he doesn't because because now as a truther, it's so boring to watch regular TV. It puts you to sleep because you're like, real life is way more.
It's not that it's not even that it's boring. It's that I'm in a state where I know I can turn my brain off a little bit, and I'm on my way out. So I don't need to be thinking about anything necessarily important, so I don't mind watching something. But that's neither here nor there. What really comes down to is the main thing is we are an audio-only podcast because people are watching things too much. And if I'm during the even if I'm at a certain point in the day, if I have to sit and actually watch something and sit and watch it, my knee starts bouncing. And I have to I need to get out of here. I almost feel like I'm being sucked into this thing and I'm being trapped. But when you're just listening to something, you can go about, you can quite literally do just about anything unless your attention is 100% required for what you're doing. I mean, you being in the medical industry, surgeons don't listen to our
you can
podcast
listen,
while
just
you're
don't
cutting
watch,
somebody
please.
open.
Yeah, please don't watch while you're doing surgery.
Shoot, I did cut his leg off. I didn't mean to.
Well, I mean, that maybe I don't know. Maybe surgeons are listening to shit while they're cutting people. See, that's unnerving. It's like you got freaking Leonard Skinner in the background
rocking out in the surgery.
Just like, no thanks. That's freaking weird.
Actually, it's not that weird because I'd rather them listen to something that makes them happy instead of just complete silence. That would be unsettling to me. It's like, okay, we have to do this. Let them just
Well, all I have to go on is Hollywood. Whenever you see somebody in a surgery, all you hear is that ominous heart monitor in the background, and everybody's full attention. Scalpel. Beep, beep. And you're just like, oh my God, they could kill this guy with a flick of their wrist. And, that's how they present it. But, I guess it would be a little bit easier if, you got the doctor's head bobbing while he's listening to his favorite tunes. That might not be as freaky,
Listen to AC/DC Thunderstruck.
Exactly. That would make me happy anyway.
Oh, yeah. Hell yeah.
Yeah. So, I mean, going to the whole listening only podcast, going a little in a slightly different direction. I was actually curious, how did you find so many people to play so many? Because I know it was a horrible script to write, in the sense that there were so many people in it, and I'm like, how did you find so many people that are willing to do this? Because it may have only been one night, it may have only been one line, but I mean, just finding, it's like if you ask me to find 12 people to read a line, I couldn't do it right now. But I'm kind of an introvert in my regular life, so I don't really know a lot of people I could just be like, would you like to be in my audio drama? It would not be weird,
Just from being in the podcast community for so long now, I've met so many people, and that's why I was like, okay, I'm gonna get right on this. As soon as you sent me the script, I was like, I'm gonna get right on this. I know a lot of people. I'm gonna talk to them right now. And so I'm sending out messages the same day you sent me the script, and I'm like, okay, I need you, whatever. And then I'm going through assigning parts and whatever, and I'm like, would you guys want to do this? And everybody was just so amazing. They're like, well, of course I will. Heck yes, I will. And I'm like, fantastic. Here's your part. Yeah.
Well, that's awesome. Yeah, and that's another thing we brought up, but we have brought up before. I think one of the special things about audio drama is that you find a lot more people willing to do it. It's like if you ask them to be in front of a camera and be like, I need you to read these lines, it'd be like, hell no, I'm not doing that. But if you just have like, oh, you can just act a part and it's just audio, people seem to be very open to the idea, which we love. And everybody did a fantastic job. So everybody who's in the cast, y'all all
And
did
the wonderful
awesome with your parts, even
the
though they were
wonderful
small.
thing
They
about
were great.
people who do audio only shows, that is good because sometimes people just want to sit around in their underwear and they don't want to have to see another person on camera.
Absolutely.
Exactly. Yeah, that's
I didn't even
exactly
look at
it.
my own face.
And and the other thing,
Neither one of you are wearing
Yeah,
pants right
it's
now,
like,
are you?
yeah. Well,
Just
typically I
don't
wouldn't.
pull a Jeffrey Tubin.
But yeah. Oh yeah. Yeah, no doubt.
Yeah, well played.
But yeah, everybody who was in the show did a phenomenal job, even though I know the parts were not that big. But there were some people, specifically, there were some few people
Right.
I was like, oh, I would love to have them back on because they just read them so well. And I was like, anytime y'all want to come do this, come back and we'll get more stuff going. But yeah, there is something special about it. And,
Yeah, who is the guy? Oh, sorry, I didn't mean to
the
interrupt.
other
I specifically before I lose my thought, who was the guy that played the doctor where you're like
The cyst.
like he doesn't like he's like you're doing this wrong and you're like read it and he's like that's not the way I was taught. Yeah.
That's
the
Katillist Jones.
Yeah.
Katillist Jones is the
He
one
was-
that
he was
read,
great.
He
We
read
gotta
two
have him back.
parts.
Yeah.
He read
He was
two
so
parts,
good.
and he did the artwork.
I loved
so
him.
Shout out to
you let him know.
Kat.
He was awesome.
Now, in all honesty, I have no
You know
idea
what
what
he
a
did?
Filipino accent sounds like.
You know what
but
he
if
did?
I could imagine one,
He's like,
That would
do
be
you
it.
want me to read more parts? And I'm like, yeah, but you kind of need to have a different voice. And he goes, okay, I'm gonna watch this. He's like, I downloaded this video off of YouTube of this Filipino doctor. And he goes,
That's
I
not how he
literally-
sounds.
He's like, I
That's-
watched that over and over and over and over
Wow.
again until I nailed the voice.
He nailed it. It was so good. I was like,
Jeez. yeah, he's got to get so
yeah,
he's got to get some special
like that's what I'm
props for
saying
that
when he
one,
hears
because-
this. I'm like,
Well, and
shout
just-
out to him because he
He's
nailed it. I was like,
he's one of
"Who
my
is this?"
best buddies. He is like so
Hey, this is great.
incredibly talented.
And just to give him a little bit extra props, just so everybody knows that he's actually also the designer
And
of the
my
cover
logo.
art for this episode, which I was and Janet's logo, and I was blown away by it. I was like,
Yeah.
I couldn't have done that. That's pretty freaking sweet. And so that's actually going to be on the cover art on our website. It's actually also going to be on the download that we're going to be having for this show. And just so everyone knows, everybody, I've said it in the last episode, we're going to be having just the dramatized version of this episode. We're selling them for $1. It's just to help us out.
Although it's
And,
worth $20.99.
it's going to
so
be
there
just
you go.
Yes,
You're getting a
$29.99.
bargain, people.
20. Oh, yes, it is worth. Yeah, you're getting an absolute bargain for $1. It's
If
like,
we're gonna do marketing, it's
Halloween
$29.99 next week,
But-
so you have to get it now.
That's right. That's right.
Yeah, you have to get it now because it's only $1 right now. But either way, that's actually, it's also on the MP3 for that one, and that's going to have none of us talking in it. It's just the drama version of it. And these things are also good tools for people. If you want to see, like, instead of giving people a book about the medical industry, it's like, oh, listen to this thing. This is a true story based off an actual nurse's account, and she's actually the actress in it. So, come listen to this. But yeah, so we're just honored to have you guys on it. It was great.
I hope they liked it
I hope
too.
you liked it.
If they don't
I
like
mean,
it, I'm gonna slap
I
you
had-
all because I wrote it.
Yeah.
It was awesome. Yeah.
Yeah, I just I wanted it to be fast paced, very, very quick, and have kind of this.
Yeah, it was
Like
because
my
I was
normal
actually
day.
writing it. I was
But,
actually writing it. My brother's like, "That's no good." He's like, "This is how we're gonna."
He said,
I was like, "Okay,
suck."
fine, I'll leave it alone." Like, whatever. Like, I was actually writing it out. My brother's like, "That's no good.
Yeah.
You got to do it this way." I was like, "Whatever. Fine, piss off. Have fun."
Well, I just, with all the content that you gave me, I'm like, I don't even know how I can make a narrative out of it. It didn't feel like a narrative. It just felt like a bombardment of little of just things that were just violating.
And that
my
was only a
senses.
little splinter
So,
of what I could have
I
done
just
to
had to-
violate your senses.
Oh man!
I can violate
Well,
you
maybe
again
you can
later.
have
It's
maybe you
okay.
can have a part two of.
Talk dirty to me, Janet. Talk dirty to me. There you go.
Well, we can have a part two of anything that's along those lines, and maybe we'll have something that's more of along the something that's more of a comedy based thing where you can just really put some of your
I got a lot of
really
those.
wild out there stories that
Graphic, gross content
yeah.
coming. So,
Oh,
yeah.
God. Like when I remember when you sent me the script and you talked to me about the pressurized cyst.
Mm-hmm.
I'm not gonna lie, I was really fucking grossed out by it. I was like, I don't even know how I'm going to put this in a radio drama. It's like, this is foul.
So you don't. So I'm taking it you don't watch Dr. Pimple Popper then, huh?
No, I do not. No.
I love it. It's again anything gross and creepy and oozy and whatever. I just
it's
love
so
it.
gross.
It's
It's so
exciting to me.
gross.
The only thing I don't like, there was two things I hated, and that was shaving calluses off of people's feet. I don't like feet. I do not like feet at all.
Yeah, feet are pretty gross. I don't like my own feet. Yeah.
And butt
Yeah.
stuff.
Yeah,
We
feet
did a
don't bother
lot
me that
of
much.
butt stuff?
pilonidal cyst, which fill with poop at the top of your crack. Those are gross. And thrombosed hemorrhoids. So anytime
This
it had to do
episode
with
now
the
just
butt-
became
yeah.
episode now just
The gross
became
one.
for
The
adult
gross one.
audiences only.
Part 2, grossness. Yeah. Those are the only two things I can't stand though. Everything else is fine with me.
Yeah, I'm the same way. I can handle I mean, obviously, like I said, I've witnessed, my wife getting her C-section, and amongst other things. But I'd say the only thing that ever grosses me out is watching another human consume something that's coming out of another human.
Are we talking
That's
about
the
a certain
only time
video I know about?
that it grosses me out. No. I'm talking about anything.
Gross.
Anything
Yeah.
at all.
That
Even
is
somebody eating their own boogers, anything like that.
That could be a
Anything.
whole nother show. That's a fetish show right there with bodily fluids. Yeah.
Yeah, and y'all can keep it. That's a
Hey,
whole.
why
that's-
not?
I
That'll
won't
make
be
you
there
puke.
for that episode. I will not write that one.
Make a radio
That's
drama
the only
about
thing
it.
I can't handle.
Just see how gross you can make a radio, like just
no.
purely
I can
audio.
totally- is this a
Pure
challenge?
audio. How do you make an audio of pure, just something out of pure audio drama?
I
Make
could
people
totally do
want
it.
to gag.
I
That
could
would be
totally do it.
quite an experiment. I would love to see if
Challenge.
that.
Oh, that would be an experiment, an audio only show.
Challenge.
That would
Physically
make
want to vomit.
like truly, yeah. It's like it's almost like it would almost be the entire experiment would to be to show you the
Exactly.
power
That's
of
why I
your
think it'd be
imagination.
No, you know,
You're like-
you know what it is.
What?
I was gonna say, like this goes back to the, fear or the depression, anxiety thing. It's easiest to control people when they're under fear. So that could be our experiment on the show, is to
Right.
do a show just to scare people and gross them out, whatever, and then a bunch more people will have depression and anxiety because of the show.
No, actually, no.
Just kidding, people.
You make
It
a
actually-
good. That's actually an amazing point, because my brother and I, we want to do this year, but it would have been way too much work. But next year, I do want to do the War of the Worlds thing that you talked about, Jonah. But because the War of the Worlds actually was a thing where it's the original War of the Worlds.
The 1938 radio show. Have you heard of it? You've heard of it? Yeah, I have a very strong sneaking
100%.
suspicion that was on purpose.
Oh,
and
Orson
designed to
Welles
see just how much
admitted it was
people
on
were.
purpose. He admitted it was on purpose. But I'm saying, like, just to have something where it's like, okay, we're gonna have a show where it's makes everything like, let's take Janet's the nastiest shit that Janet's ever witnessed in her nursing or autopsy career, sound effects, all kinds of stuff, and it's purely a in your imagination, and it's like almost enough to make you want to freaking vomit and be like, this is what the media does to you every day.
Exactly.
Every day they do this to you. This is what they do to you. It's nonsense. We just did this on a radio drama, and you're not even watching it. You are listening to it, and these assholes do this on CNN, MSNBC, and like Fox every day, and they're just pumping that into you now, and you want to feel like you want to vomit, and you're anxious all the time. Shut the goddamn fucking black screen off. Black Mirror, get rid of it.
100%.
Go listen to Deplorable Janet. Go listen to Truth Data Radio.
right.
Make you laugh. Like everything's gonna be good, except for the episode where we make you grossed out. That's gonna make you grossed out.
No, that's gonna be good too. That's gonna be really good. That would be a
great
cool.
idea.
I've already got like things floating around in my
I'm
head.
sure
I'm
you
like,
do.
oh my
I'm sure you
God.
do.
All right. Well, on that note, I think it's probably a good time to wrap things up on a gross note. So, but no, we really appreciate having you on, and we really appreciate all the work, and everybody who doesn't know, Janet put in tons of time into making this happen. If it wasn't for her and all the efforts that she put into it, it wouldn't have even been even remotely what it could have been or what it has been. Absolutely. And so I'm really thankful for all the work you put into it. It was fun. It was fantastic. It was an honor to put together. And I hope we can do it again. Like anybody else out there who's like,
that's also something I want to put out there is like, if Janet did pretty much all the writing. Like this was, and the legwork. This was,
and all
the actors. Janet did this, and can I just ask you, how difficult was it for you to do this?
Well, it was funny because, we had the phone conversation, and I was like going through ideas and stuff, and I'm like, okay, well, I'll work on this tomorrow. But literally, like an hour after we got off the phone, I'm like, writing all this stuff down, and then I'm like, okay, part 2. Here's another bunch of stuff. Blah, 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 blah. I'm like, I had so much stuff in my head. I'm like, just like, okay, well, here's a bunch of stuff that happened.
The only reason why I'm asking that is because I want for our listeners and any of your listeners or anybody else who comes across this to realize that, like, it wasn't as hard as you think. It was mostly we as a truther community, we are making our own content. We have to make our own because we can't watch the rest of the nonsense and I said this on the last podcast with Joe and Jen and Ben. It's like we can't watch our own stuff anymore. We have to entertain ourselves, and we can listen to our own stuff and have a blast. We can have a blast making our own stuff. Like I want to see what Deplorable Janet's idea of like the nursing community. It's like this thing. It could be something heavy. It could be something funny. It could be whatever. Or it could be dramatic, or even horror for that matter, or grossed out. And so I think it's so cool to have people to like know that what you did was it had a little bit of work, but it wasn't like something where it took up. It's not impossible.
Right.
Yeah,
it's not impossible by any means. That's the one thing I try to explain to people when it comes to this audio drama medium. There's no limit to anything that you can do except for what's in your imagination. That's the only limit you have. So there's no budget. I mean there is. Sometimes I have to pay for music, or sometimes I have to spend a lot of time finding stuff. I mean there is work involved, but it's not like the guy who does lighting on a TV show, it's night and day when it comes to how much you have to actually put into it. But the possibilities
Absolutely.
are limitless in what you can do. And so if anybody who, including yourself, Janet, if you have something that's totally not related to what we did here, and you got something else you want to do, feel free to write that. Anybody else who wants to write something, feel free. We got all the time in the world to be making more stuff, and we want more stuff to keep this going, because we're pretty young on it. But
I hope that
keep it going
the
pretty
people
good.
that are listening, I hope you take this seriously and take them up on this, because it was such an amazing opportunity to be able to do this in the first place, and then to work with the two of you, because it was fun. It's very enlightening, and they do a fantastic job putting everything together. So I seriously hope, and I know y'all are creative, so make sure you hit them up and do something about it, because it's fun.
Yeah, because we want everybody.
Exactly.
We should be the most creative people in the world.
Yeah, we want the
Not
truly
these yahoos in
spiritual, high vibration people to show the world what they are, what we are. We are not. We're not just let's show them that we're not a bunch of freaking tinfoil hat crazy people. Let's show them that we are.
They're not. They're not Hollywood copycats either. They don't have to remake everything.
Yep.
So make your own magic.
Make your own magic. Let's make our own magic, y'all. Let's do it. Let's make it.
Yeah. All right. Well, thank you very much, Janet. We appreciate you being on. We really do. And again, we couldn't be more proud and honored of what you helped put together.
Yeah,
and
I don't know where you
hope to be
edit
able to
this
do it
out, but
again
let's see
soon,
where Janet ends up after her escapades in the medical world. Let's see what happens.
Yeah. Well, thank you very much. Yep. We'll see how the show ends. So, thank you very much, everybody, and thank you, Janet, again. You have a good one. Thanks a lot.
Yeah.
All right. Bye.
Janet. 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 Janet.
I missed you, Mommy.
Hi, sweet girl. How was your day?
We did the coolest stuff in science class. We made a project with animals, tigers and snakes, and there was tall grass and water.
Really? How exciting!
Mommy, will you help me with my math?
Give Mommy a few minutes, sweetie.
Hi, honey. Are you okay? You look exhausted.
I'm sorry I'm late again.
I'm sorry you feel the need to apologize for that.
It was a crazy day, and I need to talk to you
Mommy,
about it.
Mom! Momerson! Mama! Mom!
Yes, honey. I'll help you with your math. Just let Mommy make dinner first.
Tell me what's been going on at work.
I just don't know if I can do this anymore.
I'm amazed you've had the perseverance to last this long.
I love nursing and teaching the students.
I know you do.
But Lord, I hate the politics of it. And it's like all they care about is money. They put in that damn electronic medical record system, which just made things worse. The patients are being herded through like cattle. Can't spend enough time with anyone. The doctors are so dumb these days. It's like no one even ever went to school.
I can vouch for that with my doctor.
All they seem to do is push pills and unnecessary treatments. And everyone has to come every 3 months. Why? Money, money, money. The doctor's friends are coming in through the back door after hours constantly. And then they get all of the medication samples that we're supposed to give to the patients.
Sounds like they would be better suited selling drugs on a street corner.
That's why I can't ever come home on time. I mean, seriously, who does that? My patients can't afford their meds, but we hand them out like candy to their rich friends. Oh, it's so frustrating.
I think the word you're looking for is infuriating.
And they're forcing me to get that damn vaccination again. It's all making me so upset I feel like my heart is just gonna explode. I've been having a lot of palpitations again lately.
Babe, I love you so much. I know this is hard on you. You work your fucking ass off for zero respect. You should stick it to the man. Your health and happiness is priority, though. Maybe you just need to think about trying something new. We support you no matter what.
I love you, honey. Hi, and welcome back. Today on Deplorable Nation podcast, we're going to be talking about a subject that I'm very familiar with, that's very near and dear to my heart, the medical industry.
Deplorable Nursing was written and produced by Janet Fox.
Special thanks to the cast for today's broadcast. Janet Fox, playing herself. Phone operator and patient 7, Shannon Johnson. Insurance agent, Amit Ahuja. Patient 3 and female patient A, Ellie Rocco. Dr. A and Dr. G, Katillist Jones. Dr. B, Brandon Thomas. Patient 5 and Dr. C, Audi. Patient 9, Don Grande. Mother, Lene Balcom. Dr. D, Joe Hodgdon. Dr. E, Ben Hodgdon. Nurse, Taylor Elena. Dr. F, Mike Rocco. Dr. H, Kirsten Fox. Lipitor sales representative, Len Quintard. Receptionist, Tera Vogel. Phone patient, Julia Hobson. Kirsten, played by Theresa Cassar. And hubby, played by my actual hubby, Greg Fox.
Music promoted by freestockmusic.com. Emotional piano improvisation by Alexander Nakarada of serpentsoundstudios.com. Attribution 4.0 international license. Blood Sample by Glitch of soundcloud.com/glitch. Creative Commons Attribution 3.0 unported license. Edited by Jonah Earl. Production by Joshua James Earl and Jonah Earl of True Theater Radio. This has been a True Theater Radio production. Copyright 2022. True Theater Radio.